Well, Dr. Keller pretty much summed up everything very, very nicely. But as she said, our company is Paramount Rehabilitation, and we've been in operation for about 20 years. And we own nursing facilities. I'm sure you've heard the word nursing home. So in layman terms, it's a nursing home. We have several of those, but we have different types of facilities. So you'll hear the word skilled nursing. We have a memory care unit or facility, just different types of buildings. Over the years, we've had acquisitions, meaning we've bought pre-existing buildings, and then we also have new construction buildings of our own. So you'll get to see different types of facilities and different types of, as we say, caseload or patients that will come through that we'll work with. So just like Jean said, we have, you're going to have a lot of exposure to physical therapists, occupational therapists, PT assistants, OT assistants, and speech pathologists. So that's, when we say therapy, that's what we do in the nursing home. I was just talking with the director of rehabs, and there's also going to be an opportunity to expose yourself, like she said, to administration things that go on that in the day-to-day operations of the facility. We also work very closely with nurses, whether it's an RN or an LVN. We also work very closely with social workers, marketers. So there's a lot that goes on in the day-to-day, dealings in a nursing facility. So we're very excited to get to have you come and join us with our programs. I don't know if it's uniquely, but in our facilities, most across the board, we really work interdisciplinary, or meaning all of the different disciplines, whether PT, OT, and speech, work really closely together. So you'll really see firsthand how we work together in a nursing home. And it's not, the way our company is, it's not really segregated to where you kind of go off and do PT over here, or in a different part of the building, and speech over here. We really all work. We have, rehab gyms. Some of our facilities will be smaller, where we're in a older facility, so it may just be a patient room where we have equipment and computers, and you'll get to see where even with a small space, we can make a huge difference, in our treatment with our residents. So I would like to introduce everybody. We have, I believe, 2 DORs who are on vacation who aren't here. So if you're in the second session, or I can't remember if we have someone in their sessions, but you'll meet them when you get to the facility. The first one is Tracy Lima, and she is a speech pathologist with many years of experience. And she actually is over 4 of our buildings that we do contract service at. We don't actually own the facilities that Tracy's over, but she's a wonderful speech therapist, and has an incredible team at Town Hall Arlington. So if that's your facility, that will be your contact, Tracy Lima. And we have a lot of, we have therapists, licensed therapist assistants, we have the whole gamut.
It's a fun place.
It's a fun place. It really is. It's a fun place.
We've all been together for many years, so we all like what we do.
Yes, they're a very tight-knit unit. So, and just off the cuff, we do have a lot of longevity with our therapists. One I'll introduce you to in a minute. It's been with us for going on over 20 years. So we have a really tight-knit team. So Susan Mitchell, she is my right hand. She's been my assistant for many, many years. I think 14 going on 15, I believe. Right now, Vidu Abraham is a speech pathologist, and she's our director at Linwood. She's actually on vacation. So Susan is sitting at that building right now, and she's just a great go-to person that all of you might see at some point. She helps us all with just kind of whatever we need her to do, but she specializes on our staffing and reimbursement and things like that to help the whole company with that. And she focuses a lot on what we call our South buildings, but Linwood and Larnwood. So thank you, Susan. Nicole Campbell, she is a physical therapy assistant, and she's the one I was speaking of that's been with our company over 20 years now, I think. So she is at the
Started when she was 2.
Yeah. with me.
Jean and I are going to retire in the same building.
We do joke and say we've both been with the company since the beginning of time, so we say we'll just move into the Collinwood together. We'll be roommates. We have it all worked out. So, she is our director at the Collinwood in Plano, and there we have a little kind of unique situation. We have, Nicole is a physical therapy assistant. We have an occupational therapy assistant full-time and a full-time speech pathologist. And then we have a PT and OT who come over sometimes daily, quite a lot through the week. They do the supervision for the assistants. They do the evaluations and the research and those kind of things that you'll see, that we have to do for our requirements and licensing. But she has a great team there.
Let's not forget TAF, the best
And TAF.
resort at TAF.
Yeah, you'll also be around what we call
Yeah.
rehab techs, rehab technicians, and he is the best ever. He's great, but we have a lot of great rehab techs, and those will be people too that you can see and learn from a lot. They help us with transporting patients, so much stuff. They can assist the therapist. They, clean up our workstations a lot with us. They pretty much help us do, anything that we need them to do. If we need, filing, copies made, they're our assistants, so they really help as well. So we have a great team at Collinwood. Then Elaine Goals, she's an occupational therapist, and she is our rehab director at Avante in Irving. And we have a really large team there with a lot of we have a great team there. I always tell her I don't get to see her as much because the team is so great. I'm always putting up fires everywhere else, but there they have a great team. We have therapists, assistants, I don't know that number, but a lot. And the situation there is, it's also a contract situation where we're providing therapy in that home, and it's been redone. Oddly enough, Nicole and I worked there over 20 years ago when it was, another name. So we've seen it really transform over the years. But we actually have 2 patient rooms there where we do a lot of therapy, have a lot of people. So I think everyone will be surprised at how much, therapy we could do in some of our small spaces.
Sorry, we got a couple that are
Got
coming
stuck in
in.
that construction, I imagine. Glad, welcome.
Well, it's not the easiest building to build.
Yeah.
This is only like my 4th time here, and I almost got lost this morning. But we just bought this building in April, and we're still kind of just moving everything over here, so appreciate y'all all coming here. Anyway, I'm just kind of going over our directors for the new people and what facility they're over. And the last one we have is Lindsay Herring. And she is an occupational therapist, and she is at Stonemere Rehabilitation in Frisco. And that, like I said, is it's our newest building from construction, meaning we built it from the ground up. It's been open, it was 3 years in February. And so it's our newest. And we also own a 40-bed memory care or assisted living unit right across the parking lot from it. So if you're at Stonemere, you're probably going to have a little exposure to that. And we also do outpatient, so it varies, but sometimes we do have quite a few outpatients there that will come in there. Or if Stonemere's a little different in the sense that it's kind of more of a transitional environment. So people come there for short-term stays instead of kind of their, what we say long-term, or maybe for the rest of their life, and go back into the community. So we have a lot more ins and outs, what we say, people coming and going. And several of those people will want to come back and work with the therapists that they've worked with in the nursing home or the skilled nursing facility, and they'll come back on an outpatient basis. So it's for shorter times, and they just come to the facility, they'll do their therapy, and then they go back home. So at that building, you may have the opportunity to see that as well. But we have a very large team there, probably close to 15, 16 therapists. We have a rehab tech there as well. So we have assistants, therapists, 2 speech therapists, so it's a pretty large team there. So we're very excited. We've got, I know our schedule, what we want to do is kind of pair everybody up. So when you see what facility, whether it's in session 1 or session 2, we want you to have some face one-on-one time with your DOR that you'll, on your first day, report to. We did type out some things in your packet to just kind of give you an idea of, like the ladies have said, you all look great, very professional. Two of our teams I know for sure wear black scrubs, so you'll fit right in. You'll just look like one of us. And I apologize, I think I left 2 afternoon people off on my first session, but we do have that list, so we can go over that. And then we've discussed the sessions are from 9 to 12 if you're in the morning, and 1 to 4 in the afternoon. And then those are your report times that you'll report to the DORs in your facility. The dress code, we just wanna make sure that everybody wears closed-toe shoes, or like, tennis shoes, and your scrubs. I said no piercings, just meaning you don't wanna have any facial piercings or anything, if you do wear earrings, just anything that hangs down too low, or, anything that someone could pull on is never good, maybe a necklace or something that hangs down. And then if you have any major tattoos, you just need to have those covered up. And so that pretty much outlines the schedule. I'm assuming when we get closer to session 2, then we can go over, and those, you'll already have met your DOR that you're gonna report to. Then in the next section, you can look over, and we've kind of just done a fluid, or it doesn't have to be too specific, but just to kind of give you an idea of week to week, what kind of things we will expose you to, or things in our day-to-day work that you would be exposed to. But really, I see it as you just being immersed into what it would be like in this, what we call setting, in a nursing home, if you did become a therapist, and that's the setting that you worked in. As you know, as a therapist, you can work in a hospital, you can work in outpatient clinics, you can work, as a physical therapist, maybe in sports medicine, so there's lots of different areas. So this will give you an excellent hands-on experience as to what it would be like to work in a nursing home. So, and probably debunk maybe some things that, or conceptions that you have of what you hear or what nursing homes are like. I've been in them so long, I know that even my family members, would have a certain perception of what it would be like. And through the years, just because that's what I do, whether they come to see me or help volunteer or something like that, they have a different perception of what that environment is actually like. But this just kind of walks us through week to week. Everything that you're going to see and do is not going to be on here, but just to kind of give you an idea of some of the things. We'll definitely give you exposure to, maybe some meetings that we go to. You'll have the opportunity, I'm sure, to see not only treatments, but as the therapists do documentation, how we interact with nursing professionals and administrative professionals. It's a nursing facility, so we definitely clinically work with nursing and doctors, physicians very heavily. We have to have a doctor's order to do anything that we, any treatment that we do. So we work with those medical professionals, very closely. We did also provide a checklist just to kind of give you an idea of where, through the program, we feel that you should be able to, have a basic knowledge of these things. So, and of course, as you go through, if you have any questions, just feel free to ask. I'm also very involved in our building, so you're probably going to see me through your 5 weeks. I'm usually in each building at least some more than that, but at least once a week. So if you have any questions, just let us know. And then the last sheet, we put our impact presentation guidelines together. And what this is we would really like this, obviously, to be a meaningful opportunity and experience for you guys. And so we've outlined what the goals of this and the criteria, but we're asking each of you at the end of your 5-week session to do a presentation for about 10, maybe 15 minutes that you'll present to the team, where you go in and over your course of your session, pick a patient. Want somebody that we're working with. And they could be seen by all 3 disciplines. They might just have PT. They might just, maybe you are very fascinated with speech pathology. And you might not know this, but speech therapists work a lot with swallowing in the nursing homes. And that's really come a long way just since I've been out in the field. But you'll get to see that, and that's a pretty interesting, I'm a speech therapist, I think so, but thing that you might be able to see an experience with that. But pick something or a patient and kind of follow them through their course of treatment while you're in your session. We want you to explore and look at what their diagnosis is, why they've come to the facility, what their situation is. Do some research on what their diagnosis is, what kind of deficits does maybe that diagnosis, do you see with that diagnosis that in turn you're possibly seeing with the patient that we're treating. And then also you can tie that into how you interact and see the therapist, how their goals are, working with that patient to try to get them, you'll hear prior level of function a lot. So we want to get all of our patients back to, hopefully better or to where they were before. So you can kind of form your presentation on that. And then let us, give us some information about your overall experience. And we're excited to, at the end of your journey, to hear about how it's impacted you and maybe how this has helped to shape your goals going forward. Hopefully in a positive way, and how it's enlightened you and what you've learned and maybe didn't know before you started regarding all of our different professions and how we make an impact. So do y'all have any questions on anything that I've gone over or anything?
How does that sound?
Jennifer, would you like to address how they check in each day, or is that up to the DOR?
Sure, no. Most of our, I guess all of our facilities, when you go in, usually the therapy department is going to be not right in the front. But every facility will know about the program, know that you're coming. So if you just want to check in at the front with the reception, there's always a reception desk in the front. Then they can just call us down. Certainly on the first day, we will come down and greet you, give you a tour of each building, kind of let you know where everything is. And then after that, you can pretty much just come down to the therapy department and check in. We're going to have each DOR will actually, we may have a timesheet or something where we check you in and we'll log your hours so that we can report your hours for you. But after the first day, once you're oriented to the facility and everything, you can just come down to the therapy department at your scheduled time.
And what do they do if they find out they wake up sick one day or they have an appointment or something?
Yeah, what we'll do is, like we said, we'll get you the information. We wanted to have some FaceTime with your DOR so you can put a face with the name. We'll give you their contact information. So if something happens, you're running late, you're sick, you just need to check in with your DOR. Let them know. If you know that something's come up, let's say, next Tuesday you have a dentist appointment you need to, or something, you just let them know and, just really communicate. We always say we're very big on communicating, very transparent, and just communicate with us. Just let us know if you have any questions. We're all pretty easygoing and, just very, we don't want to seem intimidating or anything, just very presentable, just, approachable, I guess I should say. Just ask us if you have any questions. Let us know if you have any concerns or, if you're wondering what we're doing or why. If you can't come, just let us know. Yeah.
How early do you suggest we start working on our presentations during that session?
Yeah, we talked about that. Since I guess you have 5 weeks,
Yes.
I would say probably in the first week to week and a half, you probably need to, know kind of who you're concentrating on. Your DORs could also help you with that in the sense of they might have somebody in the sense of who, some of our buildings like Stonemere, well, there's going to be people that are there 5 weeks, but some of our other facilities, we're going to see people way past the 5 weeks. So just somebody that maybe interests you or somebody that maybe you feel like a connection with. I know the gentleman here that we'll introduce in a second, one of them in their presentation when they went through the program kind of connected because it reminded them of one of their family members. So,
Okay.
whether it's an interest of you see what's going on or just someone, there's been through the years, patients that I just love them. They're just sweet. You kind of connect in that way.
Mm-hmm.
So that may be someone that you're drawn to. But you want to make sure you allow yourself enough time to, get your presentation together. You don't want to wait till week 4 and then, be scrambling around. You know, we did discuss, kind of doing something maybe on PowerPoint and, you know, you want it to be, you know, look good. So I would choose pretty early.
Yes, and are we supposed to give the patient that we choose, like ask for their consent before doing it and let them know ahead of time?
Yeah, we'll
Okay.
discuss that, and what I would do is, like I said, have some dialogue, some conversation with your director, and they can help you too, you know, they're gonna know the dynamics if there are any of, maybe that's not the best person to, you know, that maybe would be as appropriate as, maybe look at these 3 people. They'll be able to help navigate that with you.
Okay.
And those are good questions.
Sorry, another question. During this internship, do you suggest that we carry around maybe a notepad to take notes on during our internship, or do you think we're gonna be so busy that we shouldn't really have that on hand?
No, I think that's a great idea. You're gonna have a lot of time, I know, to observe and to really kind of sink things in. And that's why I say, if you do have questions, please just feel free to ask. You're gonna see a lot going on, and so, in some places more than not, it's maybe a little bit more fast-paced. But yeah, if you have questions, and then you can jot some notes down, and then, you know, there's definitely gonna be more downtime where you can, you know, ask questions, or if you need clarification on something, we'll be glad to provide that for you. Yeah, sure. Does anyone else have any other questions? No? Okay. Yes. Nicole.
I didn't see on the handout about the cell phone use. I don't know if that's been discussed at all. And I'm just gonna say this, in all the facilities, you're gonna see some of the staff using their cell phones, but that is really not very appropriate. At times, a lot of times we're communicating with someone in another department, depending on what size your building is, but don't take that as an opening for you to have your cell phones out and doing stuff. Because we've had to write up, even therapists have been therapists for 15, 20 years for lack of professionalism. That is just not appropriate. A lot of times we try to get away with saying that we're using our cell phone to time them doing an activity, but we really need to cut back on that, okay? So you just don't want any questions about cell phone use. So the best thing is don't bring it out, okay? Unless you know you have an emergency, and go to your DOR and say, oh, I'm expecting a call. I don't know if you have kids or not, and we can understand that. But overall, let's not try. You're gonna see us with our phone, because as DORs, we're constantly in contact with either Jennifer, our MDS coordinator, marketing. So our phone use is very different. So don't take that, I'm just saying, don't take that as an opening for you guys to have it out.
Yeah,
Because it looks really bad.
that's great. Thank you
Okay.
for bringing
I
that
just
up.
want to bring that up.
That's a great point, and, yeah, I mean, especially like someone like Lindsay, who we have a 2-story building and such a large department, we have, we're very challenged as our industry has changed with reimbursement, with scheduling and getting people evaluated timely and those things, so there is a lot of coordination that goes on, and we may have to text, but yeah, it's just best just not to even, you know, really just, there shouldn't be a reason you need to have your cell phone out when you're in your session. So, very good.
Any other questions that you might have or thoughts?
Additionally, we have asked the directors to give you a lot of feedback. We know this might be your first time in a facility such as this. This is your opportunity to learn what you're good at, where you need to grow. So when they approach you with various things that they suggest you do or not do, please take that as constructive criticism. They're really trying to help you identify what it's like to work in these facilities, and they know you don't know what is right and what is wrong. For example, the cell phone usage. So please take their advice with a, not a grain of salt, but generously. They are trying to help you. They're not just trying to make you not do something, for example.
Yeah, they want you to become the best you can be, and that's what we all want for you. So sometimes in order to be our best, we need to know what to do and what not to do, right? Mm-hmm. And so that's what is going to happen a little bit. So, you know, take that into consideration. Some of you may also find that you know some of the people in the facility, whether that be a patient, staff member that might be working in dietary or in housekeeping. What are you going to do about that? Go out and tell your buds, hey, guess whose mom works down in the department where I am? That be the right thing to do?
No,
Oh, what would you do about that?
keep silent.
Keep it to yourself. How many of you took the HIPAA course? Right, okay, good. And now we want you to make sure that you're abiding by that. You asked an exact question, and what name would I use on the patient that I'm observing? Would I use the entire name? Probably not. You might use a pseudonym, right? That this was Miss Jones, or Mr. Smith, or Mr. H, or Miss H, right? So those are all good things for you to keep thinking about doing. And then you're going to have a person that's there to help you within that department, so ask them for help, okay? Well, I want to introduce you to the real experts. Dr. Sheila Gallagher has been through this rodeo with some of our students before. So I'm going to ask her to say a few words to you about her experience with working with students like you who were just a little bit further along in their educational process. And then I'm going to ask two of our students who were sitting in their seats like you that are now in professional programs to tell you about their experiences and to tell you about some of the things that they learned from those experiences, and what a wonderful summer that you're going to have because of the great people at Paramount that are willing to give of their time and their talents to help you become the very best that you can be. So Dr. Gallagher?
Thank you,
Are you
So, welcome. I'm telling you, congratulations for being in this room. Congratulations. Before you got here, Dr. Valerius and Dr. Keller made a point to share with our directors of rehab, with Jennifer and myself, what all you've done to be here. Where you are in your educational levels, how impressive it is in terms of the level of coursework that you're already doing at this age in your life, and how well you are doing it, okay? And so I was already pumped up to meet you before you got here. Everybody's been talking, your fan club's been coming ahead of you. But when I saw you march through the door and I shook your hand, my goodness, thank you so much for being so professional, looking so sharp. I mean, I know it is 10 and not 7 in the morning, but you have traveled. If you're like me, I did about 4 loops to even get here, and this is a big building. And I'm not going to talk about, listen, everybody got here within a 15-minute window. Perfect, don't worry. Once you get to knowing where you're, and you won't have to ever probably come here again. So anyway, we're proud of this new building, but it is difficult finding your first way here for all of us. When you find out, or you know the buildings you've been assigned to, the facilities that Jennifer was talking about, one little thing I would do is take a dry run, if you can, figure out where they are. You may have already done that. But if not, see if you can between now and Monday, or just start out a little ahead of time, because, a lot of them are, you get there through major freeways, and those can always get blocked. Anyway, I will tell you, I've had the privilege of working with students such as yourself, for the last 5 years with this grant project. I actually got in on the very front end. I was asked by Dr. Keller and at that point Dr. Clayton Holmes, who is head of the physical therapy, at that time was head of the physical therapy program at UNT Health Science Center in Fort Worth, if as a corporate owner, and I actually have owned and operated skilled nursing facilities just like Jennifer. I actually divested myself of those last year. We had a sale and we sold a lot of that, so I'm on to a different part of my journey as a physical therapist. But back in 5 years ago, I was doing the very same thing that Jennifer is doing, and running facilities, and I got asked, can you be a corporate sponsor to this grant project? Trying to understand what that grant project was all about. Being a physical therapist, now 36 years, woo, long time. But I will tell you, physical therapists, I've loved every minute of it, not trying to persuade you in the room. I have a niece that's a speech therapist and she loves it, I understand that's what you're looking at. And OTs, they're wonderful. But PT, anyway, I've loved every minute of it, but I will tell you, in the last 5 years, being able to engage with up and coming young, brilliant minds, as you are, that are looking and exploring, should I not go into these professions, it has been so invigorating for me. And what I have shared with the DORs that you've been introduced to this morning is that the DORs in my organization prior to me being here found the same excitement in that. And I think that, and they're new at accepting the student internships that you're going to, but they're excited about it. And behind them comes a whole team, PTs, OT, speeches, you've heard. So when you get to your departments, this is the face you'll know of the DORs that you're meeting today. But you will meet a whole team of therapists. And I will tell you, learn who they are. Learn their names, get to know them. Because in my 35 years, I'll never forget that every step along the way in my career, it was because of someone I met. I mean, and I had an opportunity early on, I'm not gonna bore you with my history, but I did have an opportunity early on, 10 months after getting my therapy degree, to launch my own company, okay? How did I do that? Well, it wasn't because I was just so super smart and had that plan and it was mapped out on a big board and had a PowerPoint about it. No, it happened for the most part, if I unravel that whole story, it goes down and breaks down to networking with people, making and forming relationships. If that is the people who encourage you, if it's the people who lead you, it's the people who advise you, whatever, every single time you have an opportunity like you have right now, don't waste a moment and get to know every single one of the therapists, the folks that work in your departments, because and we do have some guest speakers for you here today who have been exactly where you are, came through this program, went through these summer experiences, and now are in their post-professional programs, in their doctorals and PT programs right now. But I think they will tell you that that's just another hurdle that's on your journey that you're gonna go. Whether you go PTA, CODA, speech, OT, that path is ahead of you. And it's gonna need to have letters of recommendation, people who can be called and tell them about how you have performed in these environments, and you want them to be excellent reports, and they will be. But you wanna know those folks by name, okay? So I just wanna tell you that we are honored to have you, and I hope you are just as excited to get into these therapy departments and really start to see the inner workings of the professions you're considering. Because I have no doubt when you're done, you're gonna pick one of those professions and say, that's why I gotta make it through calculus-based physics. That's why I gotta make it through microbiology. That's why I gotta make it through human anatomy and all these things, right? Because those are challenging courses. This is not, listen, the therapist you meet, therapist that you're gonna become, doesn't get handed out just easy peasy. You have to earn it. You're not sitting in this room because it got handed out, right? A lot of people coveting your chair right now would like to be in your seat. Because in these departments, we don't welcome just everybody come on in. You know, we sometimes make family members stay outside of the department when therapy's going on. So it is a very exclusive, intimate setting that you've got the gold ticket to go into. And you earned it. But again, as you go forward in your careers, you're going to earn it. So keep your work ethic, as you've already shown. You're not the average junior, senior in high school. You're not the average, if some in the room I've heard of already into their undergrad program maybe. You're not the average. You're well above the average. So stay there. And associate yourself, which you're doing today, associate yourself with successful people in this industry, and they will influence you, support you, guide you all along the way. And that is what this Pathway program is all about, is so that you can meet those people and pull from their support and gain their support. Well, can I introduce?
Please.
These gentlemen? Okay. 4 years ago? 4 years ago, We were doing a summer program, and we've been doing it every year since, and well, maybe one before. Jonathan Craig and Emmanuel, I always destroy your last name. Fasanya. Came to us as being selected by Dr. Keller's grant program to come for the summer programs. They came to our Houston facilities at the time. They walked in just like you will walk in on Monday. I'm like, where am I? What do? I don't know anybody here. Here's my name tag. I at least feel like I belong. I've got the scrub and the name tag. But they jumped right in, and the staff embraced them in those buildings, and the staff will embrace you in your buildings. We will promise you that. The DORs in this room commit to you that you will not be a stranger. You will be embraced as a part of the team. Okay? So sleep good on Sunday night and know that. Drive in there Monday morning going, they're going to say hello to me. They're not going to go, who is that? Okay? All right. These young men came. They experienced, they listened, they learned. The program back then offered a little bit longer time period, so they were there for full days and for longer stretches of time. But we're gonna maximize your experience. We're gonna maximize your time. We're gonna put you on overload, probably, but that's okay. You're ready. You can take that. They got through those summer internships. They went back. They were UNT graduates, right? Went back, finished their degrees in kinesiology. All right. And many times they did say, well, I know, Jonathan, you pretty much kind of accomplished that when you got to us. Emmanuel, you were finishing up. And I know that they would say that's what got us through, you know, the late nights, the all-nighters, the hard studying, thinking back like, no, I got to do this because I want to be a therapist. I want to get to that point. So that being said, they now have gone, they've got those letters of recommendations from people that they met. I met them. At that point, Dr. Kyle Williams, which was like Jennifer Burton, in our team, met them. The therapists in their departments, their different facilities met them, wrote them letters of recommendation, supported them, they did their applications, they got in. As you become more knowledgeable, I mean, already, I know that this pathway program has educated you a lot about what it takes to get into these programs, OT, PT, speech. It takes good grades. It takes being able to articulate why you're choosing a profession. Practice that, by the way, this summer. Practice it with your DORs, practice it with your staff OT, PT, whoever, whatever you're kind of gravitating. Practice, how do I say why I want to be this? Why I want to be a PT or OT? But anyway, they did all that, and they got in their programs. They're now 2 years into this. They only have one more year left. And they're going to come out. Dr. Jonathan, and go back. And now they've already committed this morning, by the way. I rooked them into being here today. They only have a short window of break because they don't get summers off. So they have a short window of break time here from their programs, and they're in the Houston. They're actually in Texas Women's University's program in Houston. But they're here today with us, and we're glad to have them. But they've even committed today, I didn't make them swear by blood, but I will, that when they're done, in a year from now, and it's a short period of time, but when they're done, they will also embrace having students come in and have that experience, because that's what we call paying it forward. That's what we call paying it forward. So, with that said, thank you for being here. I cannot take it in enough. What a great looking crowd you are. You're just amazing. I look at every one of you in the eyes, it's just amazing. So I'm excited. I will try my best to come out and visit you too. Jennifer's told me I'm welcome. So I'm going to pop my head in your departments and say hi to you while you're here these next several weeks. But Jonathan and Emmanuel, I don't know how y'all want to do this, but this is Jonathan Craig and Emmanuel Fasanya. There you go. Stand up and come talk to us about Allied Health Pathway Experience. These are my buddies.
So we don't have anything formally prepared, so we'll just kind of tag team it. And if you guys have any questions, feel free to jump in at any moment. But I'll just start out by sharing a few key tips that I think will help you guys be successful throughout this process. First of all, she already stole my thunder with the punctuality. I know I'm not taking any jabs at anyone, but make sure that you are on time every day, especially the first day. Your first impression is everything. And you want to leave a very good first impression on your CIs, your DORs, everyone that you meet. So take that dry run, maybe a day before, 2 days before, whenever you have time, do that, be there on time. But when you get there, some of you may be overwhelmed. You're gonna walk into an unfamiliar environment where you have a nurse, you have CNAs running around, you have different patients in different rooms, you have your administrator of the building running around, you got the whole rehab department back there, and you're gonna go, where am I? Why is this nursing station here? Oh, where do I go? But you have to walk in there, be confident in yourself, be confident in your capabilities, and understand that you have been self-selected, you've been selected by those around you who believe that you can do this, and understand that you need to embrace this opportunity fully. Do not take any day for granted. The best way that you can repay those who have helped you get to this point is to put your best foot forward. Okay? And then I have a few key points that I want to share, but I'll let
How's
jump in
everybody
so you don't get
doing?
annoyed.
Everybody doing okay?
Yeah.
I want you just sitting down here. I just want everybody to just know how thankful I am to be here right now, and I'm glad you guys had me to come here and talk to you guys. I just want to know how impressed I am with everybody here, that you guys are already taking college classes and already showing interest in what you want to do in the future. The biggest thing I want to say to you guys is get something out of this. Try to figure out what it is that you actually want to do or maybe not want to do. You're going to be able to see PT, OT, speech, even PTAs and the Certified Occupational Therapy Assistants. So you get to see everything. I want you to just talk to everybody. I'm pretty sure you'll be probably under one person for some time, but when I did it, I was able to shadow the OT for a day, and now that OT now is a mentor to me. I'm in physical therapy school, and the relationship that you get throughout this is amazing. Like I said, I did it 4 years ago. Until this day, I just spoke with Dr. Kai Williams, who was also like a mentor to us and introducing us into this program, and Yuri Brooks, who's also an occupational therapist, and just so many people who have played a very important role in getting us to where we want to be, and we're still on that path, we're still on that journey, still putting in that hard work. And success, I want to say that success is not a linear path. It's not straight. That's one thing I had to learn growing up, and it's always good when you have somebody that comes before you to make the mistakes for you, so you know, okay, I'm okay, I can keep going. If you fall down, you need to get up one more time than you fell down. That's my definition of success. You don't want to, if you fall down, don't be down on yourself. You know, wipe your tears, dust yourself off, and keep going forward. Because you are going to run into some roadblocks. You are going to stumble along the way. But as long as you keep moving forward and don't look back, that's all that matters. As far as your day-to-day interactions with whoever you guys are going to be shadowing or walking around with, try not to, the staff is going to, like she said, the staff is ready for you guys. They're going to accept you guys with open arms. So don't be shy. Ask any questions that you want to ask. If you don't understand something, ask. No, there's no such thing as a stupid question. Because I know you guys probably know way more than me at this age, going into trying to figure out what I wanted to do. I really didn't even know at this age. I didn't figure out I wanted to be a physical therapist until college. So you guys have a head start. Take advantage of it. Take advantage of it. It's getting more and more competitive to get into these professional programs, and you guys have a great head start. You have something very unique, very unique. This wasn't around for us. He was the first one to do this Allied Health Pathways internship, and he's the one who told me about it. I wouldn't have known if it was for him. Now he's my roommate at physical therapy school. So it's crazy how, like she said, building relationships, talk to people, shake hands, make good impressions, be on time. Just those little things will take you a long way. I'm an open book around here if anybody wants to ask me any questions as far as how we're doing, how we got to where we are right now, or just anything, just ask. Don't be afraid to ask anybody anything.
And just really be proactive while you're there. Take initiative. You're responsible for your learning. If you're CI, I keep saying CI because I'm thinking of clinical affiliation, but if your supervisor or whoever you're shadowing says something and you're unfamiliar with that term, or you don't know what that particular device is or their reasoning behind what they're doing, ask them and then go home, do research. That way you can come back the next day, be more familiar, or at least have a basic understanding of what it was that you were unfamiliar with. And also, my biggest advice would be to keep a diary of your daily encounters. And that'll cause you to do some self-reflection. And through self-reflection, you can critique yourself. You can identify what are your strengths, what are your weaknesses, and that way that'll better yourself as a future clinician. Really, those were my two biggest points, but as Emmanuel mentioned, we're open books. If you have any questions, feel free to ask us at any time. I don't know if I can leave my email.
Sure.
Yeah. If you guys have any questions, you can contact me. I'll write it up here.
Perfect.
And I know you guys have been sitting here. Do you have any questions for us? Let me ask you guys a question. What is your biggest fear? Anybody can answer. Going in to this kind of shadowing experience, What is your biggest fear? Anybody care to share?
My biggest fear is that I missed an opportunity.
Going into this,
Yeah, just like any opportunity that would have bettered me. That's my fear.
you mean outside of?
That you will miss, you don't
That
want
you
to
might
miss.
miss.
Is that what you're saying?
Yeah,
Your
like
biggest
my
fear
fear
is-
is to miss
Yeah.
something that would help me,
Yeah.
or that would just make me better than who I was before.
Don't turn down any opportunities. And even if it makes you uncomfortable situations encourage and promote growth.
Oh, that's so true. That was very well put. That could be more true. Without, I always say, without struggle, where would we be? Because when everything is going good, you don't feel like you need to change, right? I mean, they say, well, if it's not broke, don't fix it. But when you endure hardships, when you really have to have moments where you have to overcome, that's what makes you better. It's like training a muscle. You're trying to lift weights, and it's going to get harder and harder and harder, but the more and more you lift, the stronger you get. And then you pick up a bigger weight. You know, you always go to that next obstacle, the next challenge, and that's what this is. You might get something, but then you always want to challenge yourself to become better, because physical therapy is constantly changing. I'm sure there's a lot of differences of things that we learn, like human anatomy, that never changes. The body never changes, but as far as research goes and evidence-based practice, that's constantly changing. So even these therapists that have been therapists for 20 years,
Watch it now.
30, yeah.
You're right. Lifelong learning,
Yeah.
lifelong learning.
Right. This is when I met Miss Sheila Kelliger. She was Miss Sheila Kelliger. Now she's Dr. Sheila Kelliger. And congratulations on that. But see,
Just happened 2 weeks ago, wow.
after a couple of weeks, she decided to, go back and get that clinical doctorate, and that's a prime example of how knowledge is forever. You're always going to continue to learn, and that motivates us as well to, say we were talking about, getting another certification like, our CSCS, which is a Certified Strength and Conditioning Specialist, just to further our knowledge, and gain another perspective in the physical therapy world, so that's something that interested myself and Jonathan, and it's just so much. I was so scared. I'll tell you, I was scared going into this internship. I was actually from Dallas, so is he, and I moved to Houston, and I met some great people, and they provided me with the opportunity to do this, and changed my life. It changed my life. This this is awesome. I love the scrubs, by the way. Love the scrubs. It is awesome. It's an awesome opportunity. I can't brag on it enough. And I'm not just saying this because people are watching me here. I'm telling you guys, it is amazing. And I was nervous. Like you said, you walk into that facility and you don't know where to go or you don't know what to do, but just know that you're gonna have somebody who's gonna show you the ropes. Just come in there with an open mind, a big smile on your face, you know, your notepad ready, like you said, that diary, or just keeping notes of every day, what you did this day, and questions you may have about things that you did, or you observed the therapist do, then you can ask those questions and build on that knowledge daily. So that's one thing that I was able to do to further my knowledge, and also communication with the therapist. Because things can get busy, and as human beings, sometimes it may be ripping and running from this patient to that patient, and get a little busy. But I'm pretty sure if you just, excuse me, why did you do this to this patient? Why are you using this belt around the patient while you're walking them? Why do they have this problem or issue, or whatever it may be? Just don't be afraid to ask. Don't be afraid to ask at all, or just ask them to slow down. That's me. I'm not the fastest learner. When I got it though.
Yeah.
But any other concerns about going into this?